Patient Reported Measures program is a key enabler of the New South Wales Health Integrated Care Strategy. The Patient Reported Measures program enables patients to provide direct, timely feedback about outcomes and experiences to their healthcare providers about things that are important to them. Patients are involved in their local integrated care program or their local patient reported measures program if they have chronic and complex conditions. So we're really looking at trying to make a difference to patients who may be otherwise experiencing chronic and complex healthcare conditions throughout the New South Wales health system. Patients who are involved in the Patient Reported Measures program will be asked to complete a set of important questions about their general health-related quality of life, but also some condition-specific questions so that healthcare providers can really tailor their care planning, treatment decisions and shared decision-making around things that are important to you.
Mary, thanks very much for going through those questionnaires. I just want to run through some of the answers with you if that's okay. Looking at the first questionnaire we've got here called the COOS. It stands for Knee Osteoarthritis and Outcome Score. This looks specifically at how your knee is affecting you with regards to pain, function and your quality of life. Now, according to some of the answers here, you're having some difficulty putting on and taking off your shoes and your socks, is that right?
Oh, yes. And especially since I've had the back surgery as well. Yeah, it's sometimes, it's in the morning that it's the worst.
Mm-hmm. And that's certainly something that's very common with people that have knee osteoarthritis. What I'll do is, after I've done a full examination of you and look to give you the right kind of treatment strategies, I want to also refer you to one of our health professionals in our team called the occupational therapist. They'll be looking at improving your function, but also look at providing some assistive equipment that might make this task a little bit less of a hindrance for you.
So what do you mean by assistive?
Assistive devices. So things like sock gutters and long-handled shoe horns, meaning that you won't have as far down to bend to get to your foot, and you won't have to bend your knees much either.
When patients fill in patient-reported measures, the information is then shared amongst healthcare providers, but most importantly, the patient-reported measures need to be used during consultation between a patient and a healthcare provider to start a discussion point about things that matter to you. So whether it's your fatigue, your pain or your anxiety, it's really about meeting your needs and then tailoring a shared care plan or decision and treatment making around you.
Just looking at some of the other answers you've got here, it looks like you're having a bit of trouble going up and coming downstairs.
Well, that's right. In fact, I'm finding I have to go with my feet sideways now, and that means I don't bend the knee as much as I do.
Right. Certainly when we look at your knee x-rays, it shows that a lot of your arthritis is underneath the kneecap, and certainly going up and down stairs, going up and down hills, it's a common problem that we hear. You might actually benefit from a particular type of knee brace that can be fitted from another member of our team called the orthotist. So if that's okay, I'll get that set up and we can get you fitted with one of those.
Is it very unsightly?
No, it actually fits under your pants or your jeans. You'll barely notice it.
For a clinician, when we talk about patient-reported measures, the benefits to them is that patients are already filling in information that they would otherwise collect during a consultation, so it's saving them time during their consultation process.
So patient-reported measures help reduce the burden to clinicians by helping to provide a baseline of the patient's health condition or their injury or other related health conditions. So the patient-reported measures help to provide some clarity around whether the treatment modalities I've implemented have been effective. So it's a key component to my evaluation.
Well, I found the patient-reported measures helpful in a number of different ways. Firstly, as I filled them out, it made it clearer what were the things that I needed to look at and get help with doing. And then later on, as I had repeat visit after repeat visit, it enabled me to see where I'd been and where I'd ended up. And it was a great encouragement to persevere, because it's always easy to stop when you start to feel better, but that encouraged me to keep on going.
I want to have a look at another one of the questionnaires that you filled out here. It's called the DASS, which stands for Depression, Anxiety and Stress Score. So it gives us a little bit of a closer look at your emotional status. Often people that suffer a degree of long-term health problems have emotional distress. According to the answers you've got here, you've been feeling a bit down of late, would that be right?
Well, yes, I fell and broke my arm, and it's just one thing after another. And since then, I've been really quite frightened, even going out into the garden. But certainly catching the bus to go to the shops, I don't want to do it. And so I'm really feeling pretty isolated.
And it's completely normal to feel isolated and suffer any kind of emotional distress in your position. In fact, 1 in 4 people that have knee osteoarthritis complain of the same sorts of things. And it's really important that we detect this and pick this up, because left untreated, you can have sleep disturbances. You can even be in situations where your pain's amplified because the emotional side of things hasn't been taken care of. We're really lucky. We've got a social worker that works on our team that I'll refer you to if you're happy enough, and they'll work on some coping strategies, some resilience training, basically just provide some counselling and support to better help this area.
So it sounds as though there's a lot to be done. Is that right?
Yeah, there is, but we'll take it one step at a time, and what these questionnaires have been able to do is identify some of these key areas that often get overlooked. And so by addressing them one at a time, you're going to have a fantastic outcome out the other side, I'm sure.
Yeah, look forward to it, actually.
Brilliant.
Yeah. Well, when I was using the questionnaires on the computer, I was absolutely appalled when I saw how many there were. But I started, and as I started going through them, it began to make sense. So I felt like finishing them off. And really, again, this enabled me to see more clearly what needed to be touched and what I could live with, more or less. One time I forgot to fill out the questions before I went to the clinic, but they actually had tablets there so that I could fill it in, and it was still just as effective as having done it at home.
To be honest, coming from a fast-paced private practice background, I was pretty sceptical about using the patient-reported measures to start with because of the increased burden of time on myself and the patients themselves. In actual fact, it actually saves me time in the long run because it helps me zero in on aspects of the patient's health that need to be addressed. So the patient-reported measures enable patients to feel much more informed about their health, and it's a much more patient-centred approach to care, where they're able to engage with the therapist in a much more effective fashion, and they feel like they're being heard more effectively.